Hi, Mrs. J.
Hi, yes, how are you?
Pretty good. My name is Shardonnay R. I'm a student physical therapist assistant. I'm going to be working with you today.
All right.
All right, but first, can I get your full name and date of birth?
MJ 3/17/69.
All right, perfect. Okay. Well, I'm looking at your eval that you had with Dr. Chamberlain. You're a physical therapist, and I see that you are running, right?
Yeah.
Okay. So, how long have you been running?
Just about 3-4 months.
Okay, and it says
still
you
a
want to
babe.
do you still training?
Yeah.
Okay. It says that you want to run a marathon coming up in about 6 weeks.
Correct.
Okay, so have you been doing like running groups and running around with people?
A little bit, yes.
Okay, so definitely we're going to work with that. Let's see here. All right, did they explain what, like the IT band, did she kind of give you a good understanding of the?
She was like, it's here on the side. It helps to maintain some knee movement or what have you. So that's about the gist of it.
Oh yeah, it's just a long stretch of tissue on the outside of the leg, and it keeps your leg from going into this motion right here.
Okay.
So if you're running a lot and you're using it a lot, it's doing a lot of work to keep it from going in, because our knees, when they're weak, they want to go in. So if you get tired, those legs might start to turn in, and it might start to pull on the outside of that leg a lot more. So it's just overuse. So
Gotcha.
that's where we come in. We're just going to try to calm it down. Have you done any running today, or have you still been running?
Yes, I did do a little bit today.
Okay.
About 3 hours before I came to the appointment, I did a little bit around the block.
So it's
that's
still
why
a little,
I'm a little
you've been rubbing it.
feeling it right now.
Okay. Well, I'm going to do a couple tests first, okay? I just want to check your strength and everything just to see where we are, since it was been a little bit since you came for the first visit, okay?
All right.
So the first one I want to do, I want to just measure your range, okay? Just want to measure your range in your leg. And when we do a lot of our exercises, we're going to be focusing on the outside of the leg here. So
Okay.
just your glutes area, because they all attach to this one big tissue down here.
Gotcha.
Okay? So what I'm going to do, I'm going to bring this table up. And this one, we're focusing on that. That's why I'm going to check this particular range right here.
Okay.
Just to make sure that we have a good range, or see where we're looking, okay?
Alrighty.
Okay. Pull in like this. Ooh. Feeling okay?
Yeah, it's a little oogie.
Okay. All right. So what I'm going to do, I'm going to pull you right here. That leg. Ooh, yeah. If you kind of limited there.
Yes.
I'm going to line it up right here. Oh yeah. You're running about 20 degrees. Normally we want people on like 30, 35 or so.
Okay.
So we just want to focus on just getting a little bit more range in that too, okay?
Okay.
So the next one I want you to do, if you can, lie on your right side for me.
Alright.
Alright, roll this out the way. Alright. So I just want to check to see how tight this muscle is right here, or this tissue right here, okay?
Okay.
So I'm going to get you to kind of bring those legs back right here. I'm going to get you to straighten this top leg for me. You bend the bottom leg. Oops, sorry. You're fine, you're fine. Okay, I'm going to just put my hand right here if that's okay. Okay, just going to try to stabilize you, okay?
Okay.
Relax this leg. I'm going to pull it back, try to give it a good stretch. Uh-oh. Feeling a little tight there?
Yes.
Okay. Hold it here. I'm going to let it go. I just want to see how tight it is. If it holds up, maybe a little tight. Ooh. Ooh, ooh. Okay, all right, so it's fairly tight there, okay? All right. I also want to do a muscle test.
Okay.
So I just want to see how strong these muscles are on the outside. Remember I said that we needed to focus on just the ones on the outside?
Yeah.
Okay, we're going to do that again, okay? So straighten this leg all the way out for me and relax, okay? You should just kind of go up and relax, okay? Now do that motion with me again. Do that up, okay? Now I want you to hold that position. Hold it up. Okay, lift this leg for me and hold it there, okay? I'm going to push down, hold, don't let me push it down. Okay, little weakness there, okay? So we definitely want to focus on that also.
Alright.
So first, since you said you're a little irritated right here on this spot, we're going to do a little ultrasound today. Have you ever done an ultrasound, had ultrasound before?
No, I've never had it done.
Okay, well, what this is, instead of us putting just heat on top of the knee, just like a heating pad, that's more superficial. We want to go a little deeper to get into that particular area, okay? Just to kind of get some of that inflammation and that swelling out of the knee, okay?
Alright.
So we're going to do that. I want you to lie on your back. But before we do it, do you have any cancer or anything? Or?
No, none that I'm aware of.
Okay, good. Have you had any surgeries on this knee? I was
No.
wondering if I didn't see any.
Mm-mm.
All right, so you can just relax right there. I'm going to pull this pant leg up. Good, good.
I'm gonna sit up and watch what you're doing since it's the first time.
Yeah, actually. I'm going to give you this right here. Give you a little back rest. Okay, come on back. You can sit up a little bit more so you don't get much to work. Perfect. All right. I'm going to turn this on. You won't feel anything necessarily. It will be a little warm cream on you, but that's about it. Okay. I'm going to set this up. And you're not going to feel too much. I just have to keep it moving on you, okay?
All right.
Put this underneath the knee. Good. I'm going to set it up over here. I'm going to untangle this. You get tangled over here. Okay. Ooh, 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 ooh. A little chilly. I know. Ooh, I thought we had it in the warmer. I'm sorry, warned you.
All right.
All right. Here's the cream. We're just gonna try to focus on this area right here. That's where most of that pain is. Okay. All right. We'll start it. Okay. So you said you've been running for just a little bit of time.
Yeah, only about 3-4 months.
Okay. So you've been training pretty hard. So it's definitely you just kind of. Were you doing anything prior to that?
Just something minor, nothing to really speak on.
Okay, so you just started running a lot more.
Yeah.
Just okay. So usually that happens. The muscles just kind of go into a shock because you weren't doing anything before,
Right.
not a lot of stuff, and then you go into full running all the time. So we're just gonna focus on calming down now.
Okay.
Okay, I know you want to get out there, but we're just gonna calm down a little bit. We're just gonna try to strengthen all these muscles on this side. Okay.
Alrighty.
All right. Relax here. All right, that's done. Back here.
That wasn't too bad.
Didn't feel anything, did you? Good. Next, I'm gonna do a couple exercises. I'm gonna check this out. All right. So just to focus on some of those exercises, so that strengthening on that side, I want you to, if possible, to slide down, back all the way down. After I wipe you off.
Okay.
We'll leave y'all nice and loosened up. Okay. Good. Slide down for me. I'm going to move this headrest.
All the way to the end, or?
You can just lie on your back.
Oh, okay.
All right. I want you to bend your knees for me if you can. All right. All right. I see it's a little weak there and a little tight. Okay. So, just want to grab that. I'll drop some papers. All right. Let me move this out the way. I'm going to put this around your knees. Just pick those legs up. Good. All right. This one's focusing on strengthening your gluteal muscles, your butt muscles,
Okay.
and working on the outside of the legs. So we're doing two things at once.
All right.
You're going to open your legs against this resistance. Lift your bottom off the table. So lift up. Then back down. So you're going to close and open back up again. Lift up. Back down. Okay? Perfect. We're going to do that about 20 times, okay?
Okay.
All right. I know it's a little challenge, but we just want to make sure that we're challenging you just enough, okay?
Gotcha.
All right. Now I want to do, just like we were doing that test, on your side where I pushed down on you, I want you to roll on your right side again. Okay, I'm going to get you to bend this bottom leg. Straighten this leg out. I want you to put your hand on your hip. This is going to keep you from rolling back.
Oh, okay.
It'll keep you from rolling back so you know that you're not going too far. We want to make sure that you're not coming to the front. You're going to start working your front leg muscle, okay? So you're just going to tighten that leg and lift up. Oh, yeah. Back down. You're going to go up and back down. Perfect. How's it feeling?
Not too bad.
Okay, just feel a little weak. I see you shaking a little bit. All right. So we're going to do that one 20 times also.
Okay.
Just starting out, okay? But the next one I want you to do is a stretch. So we're going to actually stand up and we're going to come on over. How's the leg feeling?
It's
Not
okay.
aching or anything?
No, not too bad.
Okay. So we're going to come on over to this corner right here. I'm going to move some stuff out the way. I want you to just mimic what I'm doing right here, okay? I want you to bring this left foot behind. I just want you to lean this hip in here towards the wall. So you're gonna feel a little stretch. It's gonna be right up in here, down the leg. You feel that?
Yes.
You feel that? You're gonna hold that for about 20 seconds. I know it's a long hold, but we just wanted to kind of loosen up over time. Just ease. It's just, I don't want you to feel too much pain, just to stretch. So maybe ease up on it. 20 seconds, 3 times, okay? All right. Feeling all right?
Yes.
All right. Well, good. You're going to finish that one up, and we're going to come on back over to the table. All right. I just want to talk to you about your shoes also.
Okay.
Your shoes, do you always run in the same pair of shoes, or do you alternate shoes?
I have a different pair of shoes that I run in.
Okay. Next time you come out, I want you to bring those in, because sometimes when you run, you just run a lot, and once you run a lot, maybe on different turfs, you know, you might be running on hills, around curves and stuff, and constantly doing that same route, and those shoes can kind of wear the shoes down.
Okay.
And if they wear those shoes down, sometimes your knees can be affected as well.
Gotcha.
So we just want to make sure. I just want to see those shoes and just see how your running has been, just to see your running pattern. Okay.
All right.
So just changing the running patterns over time once you get better. That'll be good. And I actually have a couple home exercises that I want you to try. We're going to try to do a few of those. Okay. All right. Got them right here. The first one I want you to do is just like the bridge we did, but without the band. I want you to lie back down and have those knees bent. I want you to just lift your bottom off the table and then back down. Okay? You don't have to go up that high.
Okay.
You lift up again, and if you want to make it hard, lift this leg up. I know. Lift this leg if possible. Oh yeah. Maybe not yet.
Feeling that right there.
Okay, so we'll hold off on just the lift of the leg. So we'll just do a regular bridge, okay?
Okay.
And then the next one I want you to do, you can stay in this position. I just want you to tighten your gluteal muscles, your butt muscles, okay? Your buttocks. I know it's a strange one. Nobody else will need to know, okay? So you will just tighten and hold for about 5 seconds. We'll do it about 20 times. We'll just ease into it. Over time, we'll do about 10-second hold, okay?
All right.
And then the next one I want you to do is lie on your right side with your knees bent. Keeping your feet together. We call this a clamshell.
Oh, okay.
So this clamshell, you're going to keep your feet together. Hand on your hip. Make sure you don't go rolling away.
All right.
And lift that leg up. Just like open and close like a clamshell. Back down. So the hip shouldn't be rolling back, okay? All right. You're going to do that one 20 times at home. Okay. And now I want you to lie on your stomach. This one's a different one, but you're still working on your buttock muscles, okay?
Okay.
All right. I want you to just lift this left leg. Just lift it up. Oh yeah. Definitely some weak muscles back here, okay? So just lift up. Good. We're just going to ease into them. At home, we're going to do 2 sets of 10.
Okay.
So we're just going to ease into those, okay? Good, good. So you understand those, correct?
Mm-hmm.
All right. So you can actually just sit up. And I wrote down some things for you.
Okay.
Some do's and don'ts. What I want you to do, I want you to rest.
I can do
I
that.
want you to rest. I know you want to get back out there, and you don't want to lose your gains, but if you do want to do some exercises, maybe do a little swimming, or try running in water, okay?
Okay.
So if you can run in some water, that'll be good. You don't have to go in the deep end or anything. Just
No,
kind of
okay.
get those legs going.
Okay.
Okay? And if you start to have a lot of pain, use ice. Try to ice it. Calm it down a little bit, okay? The inflammation. Just calm that down. And definitely, I don't want you running, okay?
No running.
Okay?
All
No
right.
running. So I have this for you here. And do you have any questions about these exercises?
None. Well, do you think it's durable to be able to participate or get close to ready to participate in the 6-week marathon?
We can. I know I looked in your form here, and you had a goal of just wanting to be able to run a mile. So we're just
Okay.
going to focus on the short term right now,
Okay.
just to get you there, because we don't want you to get overworked before you get there, or even you might not even be able to get there because we don't want to
Okay.
overwork you, okay?
Gotcha.
So we're going to focus on that, and also we had a short term goal of just cutting. I saw you say you had a pain cutting. So just focus on just the short term right now.
Okay.
We're not gonna go too long term, we just wanna make sure that we're slowly going in, okay?
Gotcha.
So those are the ones that we wanna focus on. All these exercises are pretty easy right now, we just wanna ease into it, okay? And let's see here, I think that's all we're gonna do today, okay?
Right.
You feel like that was a good workout today?
That's fine for me.
Okay, so if you need to, did you want to ice here or you want to ice at home? Because you can ice at home if you'd like.
Yeah, I'll do it at home.
Okay, so definitely 10, 12 minutes or so, just on some ice just to calm it down, okay?
Okay, all right.
Ease into it,
Okay.
don't overdo it, okay?
Gotcha.
All right.
Thank you so much.
No problem.
Nice to meet you.
Nice to meet you too.
All right.
Okay.